Reopen the state of Oregon. Starting next Friday, elective and non-urgent medical procedures will resume at clinics, hospitals, and dental offices across the state. Governor Kate Brown making the announcement earlier today. Fox 12's Camila Orti is live with more on the guidelines and some mixed reaction.
Yeah, Pete, Governor Brown said today that Oregon is on the right path in terms of fighting this virus, which is giving her the confidence to give this green light so that Oregonians that have been waiting to get a procedure or a surgery done can get that care that they need. But health officials said providers will have to start slow, and some providers are leery to start at all. Governor Brown compared her announcement Thursday to stepping cautiously onto an iced-over pond.
Oregon is in a position where I can lift the executive order delaying non-urgent procedures for our hospitals, clinics, surgery centers, and dental offices.
But Brown said we can't just jump in. There will be guidelines for a cautious approach to restarting non-emergency appointments. That's to make sure that the PPE supply stays stable and there isn't a resurgence in COVID-19 cases. Dr. Dana HARGUNANI with the Oregon Health Authority said healthcare providers have to start at 50% of their normal appointment volume, and hospital bed capacity has to stay at or above 20%.
We are not telling providers exactly what they can or cannot do, but we know that those that are most urgent and necessary are going to be the first on the list.
That means it'll be up to each clinic or office to decide how to move forward with scheduling.
I think it's really on a case-by-case basis.
Dr. Amy Mulcaster, Chief Medical Officer for the Portland Clinic, says their locations are prepared to open back up safely by keeping tabs on PPE, requiring masks, and continuing to screen patients before they come in.
With the guidelines that Governor Brown set forth today, we can put all the plans that we've been discussing in motion, and so I think we feel comfortable with May 1st.
Not everybody is.
It's setting things up for a very scary situation.
I talked to dental hygienist Marilyn Clulow over the phone. Her profession is at the very top of the Occupational Information Network's list for COVID-19 exposure risk. She says dental professionals are scared.
When you're a hygienist, you are about 16 inches away from somebody's mouth. The spraying, the drying, it's all floating around in the air.
Those aerosols, she said, would be impossible to get rid of fully before the next patient comes in.
And what if that next patient is a senior citizen? What if that next patient is immune compromised?
Now, specific requirements on PPE for dental professionals is still unclear. In general, the governor's order states that providers have to have a 2-week supply of, quote, recommended PPE. I checked on the American Dental Association's site. They recommend, quote, the highest level of PPE available, but don't specify. Some offices I talked to told me they're ordering N95s, face masks, and special high-powered vacuums for their staff members to use. Other dental offices indicated to me they're having trouble getting PPE at all because all their suppliers are back ordered. Reporting live in Beaverton, Camila Orti, Fox 12 Oregon.